the gold standard test is virus neutralization. For canine parvo, it's virus neutralization or hemagglutination inhibition. Either can be used. And for adenovirus, it's virus neutralization. And for rabies, it's virus neutralization. Why do these correlate with immunity? Because it tells you what's happening in the animal. If that antibody is there and it neutralizes the virus, it either can't infect, or if it infects, it can't cause disease because you control it. So that's an important consideration in the dog. For the cat, the best correlation happens to be a virus neutralization or an HI test for feline parvo. And as all of you know, feline parvo is probably the ancestral virus for canine parvo. So we're really dealing with one and the same virus, and everything would be similar as you'd expect it. Now, with regard to feline caleci, virus neutralization is the test, but serum antibody is only good to fair because this is a respiratory pathogen. Secretory IgA, which you can't measure with serum, is often playing a role. And also you would have to look at multiple caleci viruses because there are many to know what you have immunity to, and you may not have equal immunity to all of them. Now, herpes viruses in general produce very little antibody, and there is almost no correlation between herpes virus antibody titers and infection with herpes virus in the cat. In fact, cell-mediated immunity does play more of a role in protection against herpes, not protection against infection. You can never protect against herpes virus infection. As I ask my students the question, and they almost always remember this, what's the difference between herpes virus and love? Well, the difference is herpes is forever and love may or may not be. So that's something that I don't think I have a single student that has ever forgotten that. They don't remember anything about immunology, but they remember about herpes virus and love. Rabies virus, you have excellent correlation with virus neutralization, but I'm going to say this now, and I'm going to say it again. No state in the United States will accept a rabies virus titer in lieu of revaccination. So although the correlation is great, and we actually use it to determine whether or not a human that's vaccinated for rabies, and all veterinary techs are or should be vaccinated, all veterinarians are vaccinated, and we use rabies titers to determine whether they have protective immunity or not. But ironically, for political reasons, we don't use it for dogs and cats, which are species in which we can actually demonstrate what the protective titers are. I know of no studies that have been done in humans where humans have been challenged with rabies to see whether they have protective immunity. We do that frequently in dogs when we're licensing rabies vaccine, and we're still not allowed to use titers. So that's something that we need to change, and we need to change it in the very near future. You can tell it's one of my soapbox issues. So with regard to antibody immunity, even when there's not a strong correlation between serum antibody titer and protection, the presence of that antibody in an adult animal greater than 6 months of age to a particular pathogen, like distemper parvo and adeno, panleukopenia in the cat, demonstrates that the animal has developed an immune response to that vaccine or from natural infection with or without disease, and immunologic memory is present. So I want to again emphasize that the antibody titer does tell us something about immunologic memory. Now, the tests that should be used to determine titers for vaccinal immunity are then viral neutralization, toxin neutralization, bactericidal tests, because they correlate with in vivo killing. So you always want to find something as your gold standard that correlates with that protection, killing, inhibition of replication, etc. In other tests, though, and most of the on-site tests use ELISA technology or they use the fluorescent antibody, they can be correlated with gold standard tests. And when they are, they can be used to measure antibody and protective immunity. So ideally, and most of them have been now compared also to protective immunity in challenge tests. So the tests that are out there really are quite reliable at this point.
Okay, so here we have another poll question. Again, it's for veterinary professionals and shelter professionals. What types of antibody tests are currently used by your organization or practice? And you can choose all that apply. Viral neutralization tests, toxin neutralization tests, bactericidal tests, ELISA tests, fluorescent antibody tests, and none. So again, this is for veterinary professionals and shelter professionals. What types of antibody tests are currently being used by your organization or practice? And choose all that apply. Okay, so we're getting some good answers. If you haven't answered yet, then please go ahead and take a moment to answer. Okay. All right. So it looks like, wow, 13% of you have used viral neutralization tests, 1.6 toxin neutralization tests, 1.2% bactericidal tests, 41.2 ELISA tests, and 12.2 fluorescent antibody, and 50% of you selected none. Thank you.
None could possibly mean you're not sure what's used. You don't really care as long as it correlates with protective immunity. So laboratory tests, there are no commercial labs that really perform the gold standard. So when you send a sample out to a commercial lab, unless it's sending the test, and many of the commercial labs do send the test on to one of the state diagnostic labs associated with a veterinary school, chances are they're not using a gold standard test. It's very difficult to do a virus neutralization test. You have to have tissue culture. You have to have a variety of things. So you have to understand that most commercial labs can't do that. It's generally going to be a diagnostic lab associated with a veterinary school. So many of the diagnostic labs then do use the gold standard test. But that doesn't mean that the on-site tests are not good, because they are.